Throughout the service branches, there are several effective programs that are helping service members and their families. We're going to learn a little bit more about the Marine Corps' Exceptional Family Member Program. So let's watch.
The Exceptional Family Member Program is a DoD-mandated enrollment program for service members who have a family member with a special medical or educational need. Medical needs include not just treatment from a specialty provider, but also mental health services provided by a mental health provider. So that might be somebody who's seeking treatment for anxiety or depression or a more serious chronic mental health condition. And education includes children who are 0 to 3 years old who are receiving early intervention services, as well as children who are school age who are getting special education or related services through an individualized education program. So related services are things like speech therapy or occupational therapy or even counseling that's offered through that individualized education program in the school. Once a family member is enrolled in EFMP, they're going to be contacted by their family support provider. And that provider is really looking to establish a relationship with that family. And if the family's willing to conduct a needs assessment to determine what kinds of needs they have and whether they want to develop a service plan, that would allow us to help the family identify some goals that they're interested in achieving, whether that's through connecting them with community resources or providing them with information that helps them to become a more confident and empowered advocate for their family member, or whether that's just helping that family get connected and integrated into their community or connected with other families enrolled in the program. The Marine Corps had a study conducted, and what we were trying to get at was this stigma that is pervasive, which is that enrollment in the program is detrimental to careers. And what that study found is that, in fact, Marines who were enrolled in the program stayed in the Marine Corps slightly longer and achieved a slightly higher grade than their non-enrolled peers. And so that was a really nice empirical study that really validated the work of the program and the way that the Marine Corps has envisioned this program being developed, especially in the assignment coordination element. Assignment coordination is really the process of looking at what a family member needs in terms of medical and educational requirements and care, and then we match the capabilities of the proposed location and then make a recommendation to our manpower team about whether that's an assignment that's really going to support that family member. It's a really kind of careful matching because we really want Marines to be able to focus on their mission and on their job instead of worrying about whether their family has access to care. At the end of the day, it is a very careful balancing act because Marines are needed where the Marine Corps needs them and where they can go to a place that's really in the best interest of their individual career progression. So we have to recognize that Marine Corps needs and career progression come first, but we think we can really find a good balance to meet those two requirements and also meet family needs.